Push.
Yep.
Hey, look, push alert. All right, stand by. In five, four, three, two.
Hi, I'm Brady with WMBB. We're back with another Facts Over Fear session. I'm joined by Dr. Elizabeth Connors. She's an assistant professor of psychiatry at the Yale School of Medicine. Dr. Connors, how you doing today?
I'm doing well, Brady. Thanks for having me on.
Um, Thank you for joining us. And there's a lot going on obviously right now, and there's a lot going on with mental health. What are you guys sort of seeing from everyone as we kind of go through these lockdowns and this pandemic?
Yeah, absolutely. I mean, everyone is feeling a little bit unhinged right now, right? Some of us are
Mhm.
just not feeling ourselves, and it's pretty normal right now for adults and for kids to feel a little on edge or worried or sad or confused about what's happening. And so, I think a lot of the reactions that the adults are having in our community, sometimes we see our kids are going through some of the same things. It's a really stressful time. This is just a very unprecedented time for all of us. And we're just trying to figure out how to cope with all of it, really.
Yeah. Now you were already working with Bay District schools on a project. Can you talk about that a little bit?
Sure. So I've worked with Bay District schools recently to implement a trauma sensitive schools project. We piloted it at Northside Elementary School, and we provided training and coaching and consultation with their teachers and school staff for a week to help them really improve their trauma sensitive practices in that school. It was really around, of course, recovery efforts from Hurricane Michael, and the coronavirus concerns were actually only starting to descend when we were doing that pilot. So it wasn't COVID, but really around how to provide more trauma sensitive supports for students.
What were students going through already? Students and families, what were they already going through after Hurricane Michael?
Yeah, so already, as this kind of long term trauma recovery process has been unfolding in Panama City and other areas there that were hit by Hurricane Michael, everybody is still a little bit on high alert and trying to gain their footing really after that's happened. And so, both the school staff and the students are continuing to kind of recover from that and get back to schedules as usual, get back to school schedules as usual, and focus on classwork and kind of get the job done. So that has already been kind of a long-term process for them that they're continuing to work through. And then, of course, this, is a whole other separate crisis that's really come up that everyone's dealing with schools closed.
How does this impact, say, uh, and when I say this, I mean the pandemic and kind of being stuck at home. How is that going to impact elementary age students versus middle grade students versus high school students?
Mhm. Well, at all ages, whether students are at that elementary, middle, or high school level, they're going to be experiencing additional stressors, just like the adults are right now, right? So it might look like being a little bit worried or confused or sad or anxious. I mean, there's a lot of things that are coming up for people during this time. With younger children who are trying to understand this, you might see them acting it out in their play. I know of some teddy bears that have come down with COVID, and kids have been giving them medicine and giving them places to rest. And that's how a younger child might process and understand what's going on through their play. Versus we see at the middle school and high school level, students are older and they're able to understand some of the information that's out there about the virus, and could even, watch some of the news media and have some conversations with their parents. We also see at the high school level, parents maybe involving their students a little bit more in deciding what the schedules are going to be in the household, or some fun ways to cope, or different ways that the family can kind of manage this together, and using them as more kind of active partners in the problem solving process for the family.
Sure. What kind of tips would you have for parents who are trying to sort of they're probably at home, a lot of them, or Maybe they're working jobs where they're leaving every day and they have to, and the kids are at home. So, what kind of suggestions would you have for parents right now?
Yeah, I think the biggest suggestion that I would have for parents is just to try to stay calm and provide reassurance to your children, right? They take a page out of our book. They're going to take our clues on how we're responding to the world as ways that they can respond to the world. And so it's really important that we model kind of calm and reassuring and fact based information. I love that the way that you've even titled this segment is Facts Over Fear, right? So parents can provide factual information to children about what's happening right now in a way that's really clear and developmentally appropriate, and not very, right? So just providing clear information, staying calm, and being reassuring that children are safe, and different ways that we can stay safe, like with our distancing that we're doing. And to do that, for parents to stay calm and reassuring to their kids, it's so important that as parents, we're taking care of ourselves. I mean, that is absolutely number one, right? As the airline attendants always tell us that, to get, if there was a loss of cabin pressure and our
Mhm.
oxygen mask comes down, we need to put it on ourselves before we put it on a young child next to us, right? And
Right.
that's because we have to be able to kind of care for ourselves before we're going to be able to care for them. So self-care is really important. And then the other two things that I always mention for parents, one is really limiting and monitoring exposure to the news and media, and making sure that whatever young people are watching, they're aware, the parents are aware of what that is. They're helping them process that information. And if it's not appropriate or not developmentally appropriate, to make sure that kids aren't watching too much of that. And then the last thing I always recommend for parents is to try to stick to some sort of a schedule or routine. I mean, that just really grounds all of us. And it can be very difficult right now because everybody's routines and schedules are completely upside down with the impact this is having on our professional lives, our personal lives. The way, families get through their day to day is in some cases very different than usual. So anything that parents can do to put some sort of schedule, routine, structure in place for the family, that's going to help everybody kind of gain their footing and cope through this.
How do you build a structure or a schedule when everybody's home all the time? What does that look like? Because I this is something I struggle with now too. I'm home on the weekends, and we're not going anywhere, and we're not doing anything. So, a lot of the schedule unfortunately is built around what I'm cooking lately and how much food I'm grazing on. So, uh, what does that look like?
It's not easy. And I'll say, even in our household, we've had to take it one day at a time with the schedules. I thought initially that I was going to be able to set out a detailed weekly schedule for my daughter that works around our work schedules. And I found that by day 3, I was erasing the board and saying, you know what? Let's just make a schedule for tomorrow. And I think that even now, as we're several weeks into this situation, there's still so much that's changing on us in terms of the distance learning expectations for students, as well as our own jobs and how they're shifting, different financial concerns that families are experiencing. Other ways that family schedules might be changing is if they have older adults in their family they're also caring for. They may be doing grocery runs for them or other things, picking up prescriptions. So there's so many reasons that our schedules have been thrown off. And I think it's important to just kind of take it one day at a time and be really realistic with your schedule and routines. Even the most basic aspect of your schedules can be helpful. So, for example, setting a specific time to wake up in the morning, get dressed, eat your breakfast, maybe have some morning goals, a specific time to eat lunch, some afternoon goals, and then a time where school and or work is going to end in the evening. Just some very basic structures like that can be helpful, even if there's some flexibility within those different times of the day. But those are the kind of schedules that we don't have right now, with schools being closed and many of us, not being in our place of work. It's all that schedule and routine that we're having to create for ourselves at home.
I find that some of us are having, stronger emotional reactions than we've had in the past. I know that I'm friends with several teachers, and they're doing this distance learning thing, and so when they saw their students for the first time, when they had that session with them, when that was over, I can't. Several of them were saying, I just cried today when that session was over with those kids. What would you say to us that are, having sort of really, really big ups and downs emotionally?
Yeah, I think everybody is doing the absolute best that they can under the circumstances, and we're all human, right? And it's okay if our kids see us feeling upset about the stressors that are going on, right? Because we have to be human in that moment with them. I know, especially for teachers, this is a really upsetting time. I mean, seeing your kids over video when you're used to seeing those students every day face to face, it just brings up so much for all of us. But I would say, make sure you're checking in with yourself. You're finding some ways to decompress, not only at the end of the day, but throughout the school day, and also reaching out to others. So we can't be face to face with a lot of folks that we love, our friends and family outside of our immediate family right now. But there have been so many creative ways that people are getting online, having video chats. There's a lot of extra phone calls happening, really tapping into that support network so that you can feel like you have that network of loved ones around you to give you strength and help you weather this, to not feel like you're alone or that you're not doing it right. I mean, everyone's really going through this crisis together.
Sure, absolutely. If I'm, yeah, well, I am a parent, but for parents, what kind of things should they be on the lookout for that are sort of warning signs, in the sense that I need to get some help here? I've got a real issue with a kid or my kid. What kind of warning signs should I look out for?
Yeah, that's a really good question. So, as I mentioned before, everybody's going to have a little bit more difficult emotions right now than usual. That's pretty typical. So, you might see your child being worried, sad, confused, anxious. But what you want to look out for are any really big changes in feelings or behavior. So, something that would be more extreme or more severe than you've seen from them before. So you want to kind of look at severity, but you also want to look at how long that's lasting, right? So is this young person feeling so worried that this is going on for multiple days and it's really getting in the way of them being able to do what they need to do? Is it getting in the way of them reaching out to others and connecting? Is it getting in the way of how they're playing or doing their schoolwork, right? So we're looking for really big changes in mood or behavior that's more than we would expect to see or for a longer period of time. And I always tell, parents and teachers, trust your gut. You know your kids. You know when something is just a little bit off because it's a stressful time, and when it's really starting to get above and beyond. So, if parents get to that point where they're really worried and they're feeling like they want to reach out and get some more help for their children, I always recommend doing that. If they're not connected to a mental health provider right now, or they don't know who to call, they could start with their child's pediatrician. Is always a really good place to start. Just get on the phone and ask who the pediatrician might recommend. For parents that have insurance, seeing what's covered by your insurance is also a good first step. And also reaching out to your school. Schools are very in touch with kind of the mental health and well-being of students, especially there in Bay County. Schools are doing it all to support students and families right now. So if there's somebody that you trust at your school, whether it's a teacher or somebody in the front office, just to ask who they might recommend reaching out to for some more support for their child.
One thing you mentioned earlier was that parents have to take care of themselves a little bit first before they can take care of their students. How do I mentally take care of myself, when I'm locked down or when I'm sort of shut in? What kind of things should I do
Mhm.
to make sure that I'm where I need to be?
Absolutely. So our options right now are a little bit limited, right? Because even those beautiful beaches that you have there in Bay County are
Mhm.
closed, right? Some of our outdoor spaces. But I would say if you have an opportunity to get outside and get some fresh air and really get some sunshine, most people who I talk to right now are reporting that that is one of the best and most helpful things that they can be doing for themselves and for their children, and just really staying active, whatever that looks like for you at your age and your ability level. Whether it's doing some exercises, in your house, using your computer, or just taking a walk a little bit outside. Staying active is really important, as well as, like I mentioned, staying connected to friends and family, right? So we can very easily feel isolated in this situation because we are physically isolated for others. And so we're going to have to kind of go above and beyond to stay connected to people that we really love and who give us strength. And then also, thinking about, are there other things you can do to stay healthy, whether it's eating nutritiously, doing family meals at home, and whatever else brings you joy. I like to say, I think people know what works for them in terms of helping them decompress. And it may be something that you used to do in the past that's kind of just fallen out of the rotation that you need
Mhm.
to bring back in, because taking care of ourselves right now is, it's not an extra, right? It's not an add-on. It's actually something we need to be doing every single day to survive and kind of cope through these stressful times. So I would say pay attention to your mind and your body.
One final thing: when this is over, hopefully sooner rather than later, what are people going to go through emotionally at that point? What's that going to look like?
It's a good question. And honestly, I think it's anybody's guess, frankly. I
Sure.
think this is going to look very different when we all go back to work and we all go back to school. For some people, it could be an easy transition and to kind of return to normal. And for others, maybe we've developed some bad habits while we've been at school, I've been at home, that are hard to break. But, change is hard no matter what. This has been a really big change for everybody, and it's going to be another big change when we go back. So we'll just have to see. But again, we have to just be kind of patient with ourselves and take it one day at a time, and, just try to stay calm and not get overwhelmed.
All right, Dr. Connors, thank you so much for joining us today. I want to thank you
Thank
guys
you.
at home for watching, and I hope this helped everybody. So have a good day, everybody.